Hello and namaste everyone. Today we'll be discussing about the COVID-19 vaccination option around the world. So we know the COVID-19 pandemic has been affecting all around the world in every aspect of the life, and about vaccination is only way out of this pandemic from all over the world. So let's talk about this. Since we are talking about the COVID-19 vaccine, what does vaccine do? Vaccine is an option. Vaccine is an thing that provide us an artificial active immunity. What is artificial active immunity? Actually, the human immune system, human immunity has been classified into two types, that is the natural and artificial. In the natural one, we have active and passive, and in artificial one as well, there is active and passive. Then what is the difference? The difference is in naturally the active form, the own body system takes active role to produce the antibody, whereas in the passive one we provide the preformed antibody that can be done naturally, that can be done artificially. Let's come to the naturally. The natural active, when we have an infection or clinical or subclinical, you may have got COVID-19 but you don't have developed any symptom, that is subclinical infection. You have got the COVID-19 and you have developed the symptoms, that is the clinical infection. So either you have a subclinical or subclinical infection, you will develop the antibody, and that is a natural active immunity. The virus has entered inside your body, your own immune system has taken part and developed the antibody. There can be a passive antibody that can be given naturally, like a mother can give the antibody to her baby. Immunoglobulin G is transferred through the placenta to the baby, whereas the immunoglobulin A is transferred through the breast milk to the baby. So this is the natural form. This is occur in the nature. We got naturally. But talking about the artificially, there can be artificial active immunity where you can give the vaccine. Vaccine, what is vaccine? Vaccine is itself a virus. The virus content, it may be a virus, whole virus, it may be a part of virus, it may be just a protein structure of virus, it may be just genetic material, mRNA, RNA or DNA of the virus that can be given into the vaccine, into the jab, and that can be given you intramuscularly. After the vaccine enters inside your body, it goes to the lymphatic drainage and then goes to the immune system. Immune system doesn't require the live or death, it just requires as the foreign antibody. Some foreign thing has attacked your body, the body will start to develop the antibody. And since there is a foreign material, so antibody is developed, but this foreign material is a dead particle. This is not going to cause you the infection. Look, there are the virus like live attenuated vaccine. When you are talking about the whole virus, we can do what we can attenuate it. Means we make the virus less infective or less vulnerability, less virulence, so that if it enters into the body, then it doesn't cause any infection. That is usually done with the polio virus and other live virus. But in COVID-19, there is no any live virus, so we all are safe, because in live virus there is some chance of in an immunocompromised patient to develop the disease. So there is no live virus in COVID-19, that you have to understand. All are the killed vaccine, killed virus or killed vaccine, that may be other like mRNA based genetic material mRNA vaccine, or there will be a like vector borne vaccine, or there will be another like protein based vaccine. So these all are the killed vaccine. What this vaccine does, they go inside your body, they trigger the immune system, your body take part in that active formation of antibody. So this is the artificial active immunity, and we are talking about this. There can be artificial passive immunity, but yes, artificial passive immunity is the antibody, free form antibody that we can give from outside, like tocilizumab that blocks the like you can say you have heard about the anti-diphtheric serum, anti-tetanus serum. These are the free form antibody that is formed inside the another part of another animals or something, and then we give into the preformed, that body doesn't have to do anything, it was already formed antibody from in the other animals or other place, and we just give inside the body. So that is a artificial passive immunity. But forget all of the things, we are talking about the vaccine. And what does vaccine do? Vaccine produce artificial active immunity. Why active? Because body, when we introduce the vaccine or the component of the virus into the vaccine, through vaccine into the body, then body makes the immune system, body activate the immune system and then produce the antibody against that vaccine. In the vaccine, the virus is not live, the virus is not complete, so it is not going to cause you any infection. Rather, it develop the antibody level because the structure is same, although it is killed. Now what happened? You are getting the virus, but it is a killed one, and it is producing the antibody inside your body, but it is not causing any infection to you. This is the rule of the vaccine. But when you once the antibody level is above the threshold, then when you get in contact into the actual live virus, then when the live virus enter inside your body and there is already free form antibody, so this antibody will neutralize this live virus and you will not get the disease. Or if you get the disease, you will not develop the severe condition because maximum of the virus will be neutralized. So that is the main concept of this vaccination, and this vaccination concept is for every disease which we are vaccine available. There are live vaccine, but we are not talking about the live attenuated vaccine. We are just talking about this COVID-19, and there is no live vaccine in COVID-19. There can be like viral vector vaccine, there can be killed vaccine, there can be like mRNA vaccine, okay, and there can be the protein based vaccine like Novavax. So these all are the vaccine. Okay, now option available to us. There are the option like WHO approved vaccine like Sinopharm and Sinovac. This is made in China, and they both are the killed vaccine. Okay, so the whole virus structure is killed. That can be killed by many ways like formalin, heat, or beta propanol, and then can be given to you. It is a totally dead virus, totally safe in any population. Okay, it is actually not tested in the children or pediatric group, so this vaccine are not approved in pediatric group, that you have to understand. Then there are the vaccine like Pfizer, Moderna, Johnson and Johnson and Novavax. This Novavax is not till approved by WHO, but this Pfizer, Moderna and Johnson, this is approved by WHO. Then there is another AstraZeneca, which is also known as the COVID-19, that is also approved by WHO. So the vaccine option that is available around the world are Chinese vaccine, Sinopharm and Sinovac, USA based vaccine, that is Pfizer, Moderna and Johnson, J&J, that is Janssen, and then UK, that is made in UK and India West, that is AstraZeneca. So this is the vaccine which you can give all around the world because it is already approved by WHO. Now there are some vaccine that has been approved by the Nepal government. Since this video is made from Nepal, so and I'm from Nepal, so I'm just to put you a list of a vaccine that has been approved in Nepal. So what are the vaccine that is available here? Here is the COVID-19, Sputnik V, Sinovac, Sinopharm and Covaxin. These all vaccine are approved by the Nepal government to give to the local people. But one thing you have to understand, this all vaccine are not approved by the WHO. Only COVID-19, the first one, and the Sinopharm, the Varocell. These two are the approved by the WHO. There is another vaccine that is approved by the WHO as well as the Nepal government, that is a Sinovac, but it is not available in Nepal. It is a Chinese vaccine. Now talking about the Sputnik V, that is a Russian vaccine that has been approved in Nepal, but it is not approved by WHO. And although it is approved by Nepal government, it is not available here. Till we have no any single dose of vaccine available in Nepal of Sputnik V. Now coming to the Covaxin, it is an Indian vaccine. Bharat Biotech has developed this. It is an Indian indigenous vaccine, and it has it is also a killed vaccine, but it is not yet available in Nepal. So it is proposed that COVAX is a worldwide vaccine facilitator which provide the vaccine to the poor country, which is donated by the large and developed country. Okay, so through COVAX there is the possibility that Nepal can get this among this WHO approved vaccine, one of the vaccine in future. Presently they have provided this COVID-19 and the previous, now there will be another vaccine that can be provided by through the COVAX facility. Even Nepal government is trying to buy the Sinopharm, that is a Varocell vaccine, which is approved by WHO and Nepal government from China, and they are saying that 40 million they are about to buy this structure. Now let's go deep inside it. When you are talking about, okay, let's make complete about this COVID-19 and Varocell. This is COVID-19 and Varocell. This COVID-19 was the vaccine that was initially proposed when developed in the UK, and that India Serum Institute of India is also making it, and that is the initial donation given to the Nepal, and we are all using it. This is one of the good vaccine. All with the frontliner, even I have get vaccinated through the COVID-19, and we are not getting infected. We are till it protected from the virus. So this is COVID-19 is an AstraZeneca. This is a viral vector borne virus, that is the modern chimpanzee adenovirus has been taken, and in that spike protein material has been given, and it is released when it enters inside the body, and against that spike protein again our immune system will develop the antibody and will give that antibody if reach the threshold level. So when the new live virus enters inside our body, the spike protein usually bind with the ACE receptor inside our body, and they combine each other, and then virus enter inside the body. When there is antibody level inside your body, the spike protein, when the virus enter, it neutralizes the spike protein, so it doesn't get chance to bind with the AC receptor of our cell. Many in the lower lungs and in the pharynx there are some receptor. In other parts also there is the receptor. So when they block the virus to to bind with our ACE receptor, they never enter into our cell, and once if it is not enter into our cell, then we are getting protected from this disease. Okay, so AstraZeneca viral vector, this is modern chimpanzee adenovirus. There is 2 shots are given. All of the vaccine are given 2 shots, and every one was initially proposed to be given at the interval of 3 to 4 weeks. Only this Covishield was initially proposed for 2 to 3 weeks, but now they are given at the interval of 12 weeks. So that you have to understand. So all this vaccine except this Johnson & Johnson, there is only single dose of vaccine of Johnson & Johnson. Otherwise all this vaccine are double doses. They usually given at intramuscularly, and they are given at 3 to 4 weeks, that is 21 to 28 days interval. That is the usual time, unless only one, that Covishield, which has given second dose after the 3 month, around 3 month. Okay, even the Novavax, they are saying that they can given after 3 months, but you remember as a whole nutshell that they all are vaccine are given at the 3 to 4 weeks, 21 to 28 days interval, except this Covishield, which is given at 3 month interval. Okay, now efficacy wise, they are 70% efficacious, when in the recent study says that they can be 90%. Okay, but first dose 70, second dose 90%. They all are storage at 2 to 8 degrees Celsius and approved by WHO and the 16th April 2021. So now let's talk about the second vaccine that is available in Nepal, and that is Varocel, which also from the Chinese company, that's a Sinopharm company. It is a killed vaccine. Okay, so and this are also the second dose is given after 21 days, efficacy is 79%. These are all are storage at 2 to 8 degrees Celsius, and that was got approved on 7th May 2021. So you have understood about this COVID Varocel. Varocel is as a vaccine that is now only an option for us at present, because we are not getting Covishield from India, because India itself has a huge crisis and they are vaccinated their own people, so they are not able to export outside the country. But this Varocel, they are exporting to us, and we are hoping that we will get more vaccine of Varocel in Nepal. Now coming to the all over the world, what are the options we have? I have already talked that there are the 4 types of vaccine. One is mRNA based, that is Pfizer and Moderna. That is the highly efficacious vaccine. They are usually around, this is 95 and this is 94% efficacy. So they are the best vaccine. Then another is the viral vector borne. This is the Covishield, Sputnik V and Johnson & Johnson. These are the viral vector borne. What we do in this? I'll talk to in detail. This is the viral vector one. Then there is a killed vaccine, and then this is the Sinopharm and Covaxin, and the last one is the Novavax. Now let me go deep inside. The first one, which is the Pfizer and Moderna, this is the mRNA based. What is mRNA based? This genetic material of this virus is introduced inside you. That is not infective actually, but this virus, when it goes inside your body, inside your cell, then it produce more and more spike protein. So it tries to produce continuous spike protein. So there are a large spike protein, and since there is a large spike protein, there is a large immune reaction, and there is a robust immune system reaction, and there is a more antibody level in your body. And because of that, this Pfizer and Moderna, this mRNA based vaccine, this is the first time in the world in this 21st century we are able to provide this type of breakthrough through this mRNA, because previously all the mRNA tried vaccine were fail only. In COVID-19 we are able to break through this, and this is the great achievement. The problem with this vaccine are they are very good, they are costly, obviously. They are you can say the highly efficacious vaccine in the world. Even Pfizer are thinking of giving to the 12 years, not 18. They are going to below 12 years. That is one source of great news. The problem is that this Pfizer and Moderna, they requires minus temperature. Like Pfizer requires minus 80 degrees Celsius for storage. Otherwise it gets destabilized. This Moderna requires minus 25 degrees Celsius for its 20 to 25 degree for its storage, and that storage system is not present all over the world. You have to remember, in the Africa, in Asia, what happens that we have the immunization schedule, we have the immunization program, but these all are what? These all are the established EPI schedule immunization program. That is true, that's the vaccine are transported at 2 to 8 degrees Celsius. So this Pfizer and Moderna in the lower developing countries, they are not going to be an option, because the transport will be issue. Although it is not impossible, there are the many labs, like in Nepal there are 100 labs and they all have the minus 80 degree freeze. We can make this 100 center. That will be not a big deal for giving this vaccine, but that will be a very impossible to provide to the remote places in the village area. That you have to remember. So the challenging part, these are the very good vaccine, but they are near the minus temperature to transport, which becomes a difficult task in the Africa and many countries of the Southeast Asia and other poor country. Now coming to with the Johnson and Johnson, this is 2 to 8 degrees Celsius. This is a good one that you can give to the vaccine single dose, and it is efficacy is about 60 to 74%. So this is okay. These are the viral vector borne vaccine. What is this? In this we take the virus like adenovirus that is not harmful to us, that is not replicating in the human, and after taking that we put the this spike protein into it, and when it enters inside your body, it produces the spike, releases the spike protein, and we develop the antibody. So this is also one of the great way of developing the vaccine, but they are actually easy to transport. They can be transported into 2 to 8 degrees Celsius. So this is widely acceptable in India, in Nepal, and other poor countries also. We can say the COVID cell is usually transported very well. This Johnson and Johnson is single dose, whereas this COVID shield and Sputnik V, this is the Indian or UK based vaccine, this is the Russian vaccine. These three are the viral vector borne vaccine. So they can be given easily, but the issue with Sputnik V is they are available in 2 forms. One is a dry and then one is the liquid form. The liquid form still needs to be stored at minus 18.5 degrees Celsius to minus 20. So that is again an issue for all over the countries like Southeast Asia and poor country in the Africa. So this is Sputnik V, although its efficacy is 91.6%, it is still is a challenge. We can import the dry form and then we can formulate into the liquid form and given at the site of vaccination. That can be done, but it is still is a challenge. Then coming to the COVID cell, it has a less efficacy because what happened with the viral vector borne, this adenovirus we already are exposed and we have the antibody against it. So we may actually not affect inside the vaccine, we cannot affect the inside the vaccine, but the adenovirus can be neutralized and there will be no antibody developed due to vaccination. So adenovirus as a vector is itself a challenge. Its antibody is itself a challenge because people are already exposed to this adenovirus. So you may not develop the antibody if you have a neutralizing antibody against the adenovirus. This vaccine may not work, but since it is easily transportable, it has a good efficacy, it has been seen as some mild side effect and been achieved as the acceptable in many poor countries. I think this will be the good option. That is, India is vaccinating everyone and a lot of country, UK has vaccinated everyone, Nepal has vaccinated many of the people with COVID shield frontliners. So that's one of the issues. Now comes to this is 70 to 90%, this is 91% I've talked about. Now coming to the killed vaccine. Killed vaccine is one of the safest vaccine because it is the 100 years old technique. We just get the vaccine, killed totally, so it become less infective, the whole structure inside your body, and then now your immune system will trigger this immunity. This is the safest way. All this immunocompromised people have to be given this killed vaccine. Among this Sinovac, this is again given at a 2-dose interval at 23 weeks interval, and they have to be efficacy of 50 to 67%. That is a little bit less because the Brazilian trial we haven't found more efficacious, so it has not been well popular. There is the Sinopharm, which is a Verocell. It is little higher, that is around 80% of efficacy, and that has been used in Nepal, in China, and they are transporting in the many countries, and that is seems to be a good option. Okay. Now another is Covaxin, that is made in India, the Bharat Biotech, and it has been found to be 78% efficacy. That is also one of the good thing, and even they are trying to give to the children. So this is also one of the killed vaccine, and it is since it is killed, it is a safe vaccine. So its efficacy is 78%. So let me talk about one thing clear. Wherever you are in the any part of the world, whatever vaccine you are getting, you should get vaccinated. There are the few misconceptions like I am pregnant woman, should I vaccinate or not? Yes, you need to vaccinate it. You are a pregnant woman means you are more risk of getting this disease, and since you are more risk of getting this severe disease, you need to get vaccinated. So all pregnant women need to vaccinate it. If I am a heart disease or say any chronic disease or cancer and a transplant patient, anything, do I need to get vaccinated? Yes, you do. Every people who have a chronic disease, who have a heart disease, who have a liver disease, kidney disease, these all are the patient having the chronic disease. If they are going to get this COVID-19 like pregnancy or other this condition, you will be affected more. You will develop more serious TBS. There will be chance of death. So to prevent that, you need to get vaccinated. So all this chronological condition, you need to get vaccinated. If you are a children, do you need to get vaccinated? No, because we don't have enough data to any children below 18 years of age. Only Pfizer is thinking of giving to 12. Below 12 there is no data, so not recommended. Who are not recommended to get this vaccine? Those people who are below 18 years of age, and in case of Pfizer that's 12 years of age, so children are not need to be vaccinated. And another is people who have developed severe allergy due to the vaccine or any component of the vaccine. So only these two conditions you are not allowed to get vaccinated. Otherwise, you in every condition, either you are pregnant, either you have any chronic disease, either you have other problem, either you have a bleeding disorder. In a bleeding disorder, you might, when you get vaccinated, you might develop the bleeding. So at that time, you need to press that wound site for 5 to 6 minutes so that there will be no bleeding, and check is there any bleeding or not. So if you press more than the usually you press for 1 minute and that your bleeding is stopped. If you press for 5 or 6 minutes, if you have bleeding disorder, yes, that could work. Okay, so from today, anyone around the world, if any age except the children, you all need to get vaccinated. Whatever the medical condition you have, doesn't change the things to get vaccinated, because vaccination is the only way to get off this pandemic. Vaccination is the only way to save your life if you have already chronic diseases that you need to manage. So everybody stay safe and get vaccinated. Thank you.